Every second, your heart pushes blood through nearly 100,000 kilometers of blood vessels. But what happens when the pressure inside those vessels quietly begins to rise? At first, nothing feels wrong. No pain, no warning. Yet over time, this silent force can damage the heart, the brain, and the kidneys. This is the story of hypertension, the silent killer. Most dangerous diseases make themselves known. They cause pain, fever, weakness, or visible symptoms that force us to seek medical attention. But one of the most widespread health threats on Earth often stays completely silent. No pain, no warning, no obvious signal. Yet, quietly and persistently, it damages the most important organs in the human body: the heart, the brain, the kidneys. This condition is called hypertension, more commonly known as high blood pressure. Millions of people live with it every day without realizing the damage occurring inside their arteries. To understand why hypertension is so dangerous, we must first understand what blood pressure really is. Blood pressure is the force exerted by circulating blood against the walls of arteries. Every time the heart beats, it pushes blood into the arterial system. This pressure allows oxygen and nutrients to travel through the body and reach vital tissues. Blood pressure is measured using two numbers. The first number is called systolic pressure. This represents the pressure inside the arteries when the heart contracts and pumps blood outward. The second number is diastolic pressure. This represents the pressure when the heart relaxes between beats. For example, a reading of 120/80 means 120 systolic pressure, 80 diastolic pressure. In a healthy system, these pressures remain within a balanced range. But when the pressure remains elevated for months or years, the constant mechanical force begins to damage the delicate inner lining of blood vessels. This is where the real problem begins. Arteries are not rigid pipes. They are living, flexible structures lined by specialized cells called the endothelium. This inner lining regulates blood flow, prevents unwanted clotting, and helps maintain vascular health. But high blood pressure places continuous mechanical stress on this delicate layer. Imagine repeatedly bending a metal wire. At first, nothing appears to happen. But over time, small microscopic cracks begin to form. A similar process occurs in arteries exposed to chronic high pressure. The endothelial lining becomes injured and inflamed. Once this protective surface is damaged, cholesterol particles circulating in the blood can more easily penetrate the artery wall. These lipids accumulate and trigger an inflammatory response. Gradually, fatty deposits begin to form. These deposits grow into structures known as atherosclerotic plaques. Over time, plaques narrow the arteries, reducing blood flow to critical organs. And this is how hypertension accelerates cardiovascular disease. The heart itself is also affected by elevated blood pressure. When pressure in the arteries increases, the heart must work harder to pump blood forward. Every heartbeat now pushes against greater resistance. In response to this increased workload, the heart muscle begins to thicken. This process is known as left ventricular hypertrophy. At first, this adaptation helps the heart maintain its pumping ability. But a thicker heart muscle eventually becomes stiff and less efficient. It requires more oxygen to function, yet its own blood supply may be compromised by narrowed coronary arteries. Over time, the heart struggles to fill properly between beats. Eventually, this can lead to heart failure, a condition in which the heart can no longer pump enough blood to meet the body's needs. The brain relies on a constant supply of oxygen-rich blood, but the small arteries that supply the brain are especially vulnerable to high blood pressure. Chronic pressure weakens vessel walls and promotes plaque formation. Two dangerous outcomes can occur. The first is ischemic stroke. In this case, an artery becomes blocked by plaque or a blood clot, cutting off oxygen supply to a region of the brain. Without oxygen, brain cells begin to die within minutes. The second possibility is hemorrhagic stroke. In this scenario, a weakened blood vessel ruptures, causing bleeding within the brain. Both forms of stroke can lead to permanent disability or death. And hypertension is one of the most important risk factors for both. The kidneys contain millions of microscopic filtering units called nephrons. Each nephron relies on a network of delicate blood vessels to filter waste products from the blood. High blood pressure damages these tiny vessels over time. As vessel walls thicken and narrow, filtration becomes less efficient. Waste products accumulate in the bloodstream. Eventually, this process may lead to chronic kidney disease. In severe cases, kidney failure can occur, requiring dialysis or transplantation. Thus, the same silent pressure damaging arteries in the heart and brain is also gradually destroying the body's natural filtration system. One of the most dangerous aspects of hypertension is that it usually causes no noticeable symptoms. Unlike many diseases, high blood pressure rarely produces pain or discomfort in its early stages. People may feel completely normal while vascular damage progresses silently inside their bodies. This is why hypertension has earned the name, the silent killer. The only reliable way to detect it is through regular blood pressure measurement. Routine monitoring allows early detection before serious complications occur. The encouraging news is that hypertension can often be controlled. Lifestyle changes play a major role in prevention and management. Regular physical activity strengthens the cardiovascular system. A balanced diet rich in fruits, vegetables, and whole grains supports vascular health. Reducing salt intake can help lower blood pressure in many individuals. Maintaining a healthy body weight also reduces strain on the heart and arteries. In some cases, medications may be prescribed to regulate blood pressure. These treatments help protect the heart, brain, kidneys, and blood vessels from long-term damage. High blood pressure may not cause pain. It may not disrupt daily life, but the damage it causes is very real. Over years, uncontrolled hypertension silently weakens arteries, stresses the heart, and threatens vital organs. The most powerful defense is awareness. Checking blood pressure regularly. Adopting healthy habits. Seeking medical care when necessary. Because when detected early, the silent killer can be controlled. And controlling it protects the entire body.